Hi, this is Alyssa Morez, and this is my presentation on Medicare fraud for my Research Methods in Health course at Boise State University. Throughout this presentation, I will be talking about what Medicare fraud is, common types, and examples of each. Hopefully by the end of this presentation, you will have a better understanding of Medicare fraud and how to prevent it. So first, what is Medicare fraud? It's a collection of Medicare health care reimbursement under false pretenses. There are many different kinds of Medicare fraud. The most common types of Medicare fraud is fraudulent billing, patient kickbacks, and upcoding. First, fraudulent billing. It's when an individual or a practice bills Medicare on fraudulent pretenses. Examples of these can be through tests, procedures, drugs, and medical equipment. The next is patient kickbacks. This happens when doctors pay patient recruiters money for the recruitment of patients. And it happens quite often in bigger cities where there are more patient populations. An example of a patient kickback is in 2010 in Los Angeles, a medical center had to pay $10 million for paying illegal kickbacks. The recruited homeless patients underwent a variety of medical treatments that were not necessary, and then they were billed by federal healthcare providers. Last is upcoding. This is when many practices and offices will bill for more costly services than the one that is actually performed. An underlying issue of fraudulent billing, which today is the most common one we see. For example, you may go into a doctor for just a common cold and be treated for the common cold. The doctor then may bill you for pneumonia even though you have just a cold. Recent National Medicare Fraud Takedown. An example of this was released on June 18, 2015, when the Department of Health and Human Services Secretary Sylvia Burwell and Attorney General Loretta Lynch announced that a nationwide led by Medicare fraud strike force in 17 districts. It resulted in charges against 243 individuals, and this included 46 doctors, nurses, and other licensed medical professionals. In the end, it resulted in over $712 million in false billing. The defendants now are being charged with money laundering, identity theft, healthcare fraud, and violations of anti-kickback statutes. If you'd like to read this article or more about it, there's a website right here that you can click on. So next, how to prevent Medicare fraud. First, don't ever give your Medicare, Medicaid, or Social Security information to strangers. Always keep records of your doctor visits, tests, and procedures. And keep an eye on billing statements. Make sure you're not getting billed twice or charges for something you didn't get, or services that were not ordered by your doctor. I recently just had surgery a couple months ago, and I've had many bills come in the mail that I thought I've already paid, and so it's always good to ask questions if you don't understand a charge. So make sure you always ask if you don't understand something. And ask questions if you feel services provided were unnecessary. So that is the end of my presentation. I hope you enjoyed it, and thank you for watching.